The road to recovery from substance use disorder is full of twists and turns. And while the path forward looks different for everyone, recovery is a lifelong process that requires mental, emotional, and medical support. Treatment varies depending on the types of substances you use, how long you've been using them, and any underlying mental health or medical conditions you may have. Relapse risk factors like long-term substance use and your living environment also impact the type of treatment that's recommended. There are a few overlapping routes healthcare providers take to help you with addiction and prevent relapse. To access the following treatments, there are inpatient, outpatient, and residential options available. Detoxification. The first major step of recovery is known as detox, or withdrawal management. The goal is to stop taking the substances you've been using as quickly and safely as possible and allow them to fully leave your body. In the most severe cases, it may be unsafe to stop taking substances cold turkey. If you've been using a substance for a long time, like alcohol, for example, sudden withdrawal could lead to seizures, delirium, heart attack, or stroke. Because of this, it's always safer to discuss withdrawal risks with the help of medical professionals. The process of detox can last anywhere from 3 to 10 days and varies for everyone based on how long you've used a substance and the severity of your withdrawal symptoms. During this time, your body has to get used to functioning without having these substances in your system. As your body returns to normal, you may experience a series of withdrawal symptoms that may include shaking, shivering, or sweating, nausea, diarrhea, or vomiting, increased heart rate, increased blood pressure, headaches, abdominal cramps, muscle pain, insomnia, and exhaustion. You may also experience psychological symptoms that include intense cravings for the substance you've been using, heightened anxiety, confusion, paranoia, depression, mood swings, or difficulty concentrating. Because these symptoms can be so severe, it's important to have around-the-clock care and support during this time, especially if you're participating in an outpatient treatment program, partial hospitalization, or day treatment program. Some of the more mild symptoms can also be experienced months after initial withdrawal. Medication. You may be prescribed medications to help manage withdrawal symptoms while you're tapering off the substance you're using. Or, in the case of opioids, you may be prescribed medication that helps your body adjust to withdrawal and reduce the intensity of cravings. Prescribed medications aren't just tools that can be used during the withdrawal period either. In many cases, medications can be lifelong interventions that prevent someone from relapsing. Therapy. With substance use disorder, it's just as important to take care of your brain as it is to take care of your body. Taking a habit-forming substance for any period of time can have a negative impact on your feelings, your behaviors, and how you cope with the world around you. This is because these substances have the power to change your brain chemistry and cause unwanted or unexpected behavioral changes. And any underlying mental health conditions you have could be made worse because of substance use. A counselor or therapist can work with you during treatment to address any mental health conditions you have, as well as help you identify helpful ways to cope without substances. Address any shame, guilt, or regret you may have. Embrace strategies to avoid and prevent relapse. And talk about other factors like employment, relationships, legal issues, housing, and nutrition that may have caused you undue stress, anxiety, or depression. Therapy can be done in a group of like-minded peers led by professional counselors or on an individual one-to-one basis. Follow-up care. Substance use disorder is a chronic, lifelong condition that can be triggered by a myriad of factors related to your environment, your health, your relationships, and even memories of what you've experienced. Continuing therapy on a regular basis, joining self-help groups, and 12-step programs are all great tools to ensure you stay on the right path to a healthier you.